heart tube takes place from 3rd to 6th week. Is it right? Okay. What about the development of atrial system? We have studied both the aortic arches and the other important arteries in our body, right? So the development of your atrial system takes place from which week to which week? From which week to which week? And what is the source for the development of your atrial system? How many sources are there? 2 sources. What are those? Pharyngeal arch artery and dorsal aorta. Okay, fine. From which week to which week the development takes place? Okay, next we'll move on to the developmental anomalies of the heart and also the aortic arches. Any idea about the anomalies of the heart? While discussing heart tube, at least they have mentioned 1 or 2 anomalies, right? Any idea? Congenital heart defect is the abnormalities of the heart or any other great vessels present at the time of the birth. Okay. Etiology for this congenital heart defect is usually the environmental exposures like rubella, teratogens and the maternal diabetes, and the other factor is genetic factor, that is trisomy of 13, 15, 18, sometimes it's 21, and also the Turner's syndrome. Based on the position of the heart, we have 2 important anomalies. One is Dextrocardia and the other one is Ectopia Cordis. Okay. So what is Dextrocardia? Seeing this picture, can you define it? What is Dextrocardia? Yes, right. So basically, Dextrocardia is a rare heart condition in which your heart points towards the right side of your chest instead of the left side. So this is the normal baby where you can see your heart pointing towards the left side, but in the Dextrocardia condition you can see the heart pointing towards the right side. Okay, so Dextrocardia is a congenital abnormality, which means people are born with this abnormality. Less than 1% of the general or overall population is born with this Dextrocardia. Okay, Dextrocardia can also occur in a condition called situs inversus. Okay, in normal Dextrocardia means your heart pointing towards the right side, but if it is present along with the condition called situs inversus, this results in the chambers and blood vessels of the heart are also reversed from side to side. That is, all the structures that are normally lie or present on the right side will be present on the left side, and also vice versa. With it, many or all of your visceral organs are on the mirror image side of your body. For example, additional to your heart, your liver, spleen or other organs may also be located on the opposite or wrong side of your body. Okay, this happens when the Dextrocardia is present along with the situs inversus. If it is only Dextrocardia, your heart will be pointing towards the right side instead of the left side. Next condition is Ectopia Cordis. Basically, the heart lies exposed on the front of the chest and can be seen from the outside due to the defective development of the chest wall. This occurs due to a failure of your chest wall to properly fuse during the fetal development. This is how the normal heart will look. You can see here, but this is how the ectopic cordis, which means the heart lies exposed. Okay, the same condition seen in the newborn baby. So based on the abnormality of position, we have 2 conditions. One is Dextrocardia and another one is Ectopia Cordis. What is Dextrocardia? It is a rare heart condition in which we can see the heart pointing towards the right side instead of left side. When it is present along with your situs inversus, we can see we can see the other organs also present in the wrong side or in the opposite side of our body. Okay. The next condition is Ectopia Cordis. What is Ectopia Cordis? Due to the failure of the chest wall to fuse properly, your heart lies outside or it is exposed. This condition is called Ectopia Cordis. Next we have the defective formation of the septum. How the septums are formed in the body or in the developing embryo? How many septums are formed? What do you mean by septum? Dividing two. Okay, fine. So how many septums are present in our heart? Can you name them? Okay, fine. How they are formed? Or on which week the development of septum takes place? On which week the development of septum takes place and how they are developed? Based on the formation of your septum also we have few defectives or abnormalities. Here I have named only one or mentioned only about the one abnormalities. Please refer your textbook. There are 3 to 4 other abnormalities also. Whichever is important, I am discussing that right now. Okay. We have the defect of the spiral septum. So what is spiral septum? Where we can see the spiral septum? Okay. The spiral septum may not be formed at all. This condition is called patent truncus arteriosus. Before discussing this, let us talk about the picture. This is a normal heart. What are the circulation or what are all the event can you see here? What is this blue part? What is this blue part? This one. This one. And this is? This is atrium, right? This is ventricle. So what is this? Okay, fine. And what about this? Left ventricle. And this is? And this is? What about this part? This is? Light blue colored is pulmonary trunk. And what about this? Arch of aorta. So what is the difference you are seeing from this to this? There also we have right and left ventricles, we have pulmonary trunk and we have aorta also. But what is the one difference you are seeing from this to this? Any one please. Aorta and pulmonary trunk are connected. Okay. Aorta and pulmonary trunk are connected. Any other point? Interventricular septum is defected or abnormality is there. So the ventricles are not divided. Okay, fine. Any other answers? Here it is clearly mentioned it is a ventricular septal defect. What he said is right. There is no presence of ventricular septum between your two ventricles. So we can see the flow are passing through your both pulmonary artery and the arch of aorta. This condition is called patent truncus arteriosus. So the patent truncus arteriosus is formed by the defective of which septum? Spiral septum. You can also mention as ventricular defect septum. Defect in ventricular septum. Okay. Next we have one more important condition called Fallot Tetralogy. It is a combined defect where we can see the conditions more than 2 or 3 that exist at the same time. Okay. 2 or more of the defects may coexist. One classically recognized This condition has Fallot's tetralogy. Okay, so your Fallot's tetralogy consists of 4 defects. Those are interventricular septal defect, aorta overriding the free upper edge of the ventricular septum, and the pulmonary stenosis, hypertrophy of the right ventricle. Okay, here is the normal heart. We'll start from the interventricular septal defect. Where you can see the interventricular septal defect? Here, ventricular septal defect. Here you can clearly see there is a separation between your right and left ventricle, but here you cannot see any separation between the ventricle. They both are combined. This is called interventricular septum defect. Okay, next the second one is aorta overriding the free edge of the ventricular septum. This is the overriding aorta. What do you mean by the overriding of aorta? Can you see any difference from this to this? Overriding of aorta over the free upper edge of the ventricular septum. So we can already see the defect in ventricular septum. Upon that your aorta is running. Okay, here you can see the normal heart have aorta here. Here you can see the part of aorta overriding your ventricle. Okay, next we have pulmonary stenosis. What do you mean by stenosis? The word constriction. That means the decrease in the diameter of the particular structure will take place. That is called pulmonary, that is called stenosis. In here in this condition we can see the pulmonary stenosis. Here, pulmonary stenosis, this part. You can clearly see the difference from this to this. Okay, and the last condition is hypertrophy of the right ventricle. This is the hypertrophy of the right ventricle. What do you mean by hypertrophy? Basically increase is right. Any other word? Thickening of the muscle. Okay, any other answers? During the development, few structures will do overgrowth more than which is required. For such condition we name it as hypertrophy. Okay, whatever you said, thickening of the muscles and also the increase in size, both are same. So here in this condition we can see the hypertrophy of the right ventricle. All these 4 conditions will take place simultaneously and leads to a defect or a abnormality called Fallot's tetralogy. Hypertrophy is nothing but increase or the abnormal growth. It will grow more than which is required. Overgrowth, I can use the word. So here in this condition, your right ventricle is overgrowing. That's it, not more than. So this 4 condition leads to a Fallot's tetralogy. That's all about the abnormalities of the heart. We discussed about the abnormality in the position, abnormality in the septum, and one more condition called Fallot's tetralogy or a combined defect, where we can see the 3 or 4 different defects occurring at the same time. Okay, next. Anomalous development in the pharyngeal arch arteries. We have already seen the development of the normal arterial pattern is dependent upon the disappearance of some parts of the pharyngeal arch artery. While discussing in the last class or in the last week session, I have told the disappearance of first, second and also the fifth pharyngeal arches will take place, whereas only the third, fourth and sixth will remain. Right? So, occasionally this process is disturbed in that some parts that are normally disappear will persist and the parts which are normally persist may disappear. Okay? As a result of this condition, several anomalies may be produced. Some of these are as follows: double aortic arch. While seeing the development or the derivatives, we have seen only the development of aortic arch on the left side, that too only one aortic arch, but here you can see the development of two aortic arches. Okay, next one is right aortic arch. So what is right aortic arch? There will be no presence of left aortic arch, which usually happens in the normal development. Instead of that, we can see only one aortic arch on the right side. Okay, the next one is the ductus arteriosus, which is also known as patent ductus arteriosus. In this condition, the ductus arteriosus, which is normally occluded soon after the birth, may remain patent. What does that sentence mean? The ductus arteriosus, which is normally occluded soon after birth, may remain patent. So where you see the ductus arteriosus? Where you will see the ductus arteriosus? Whether it is related to your pharyngeal aortic arch or dorsal aorta. Ductus arteriosus is related to your pharyngeal arch arteries or to your dorsal aorta. Pharyngeal, okay, right, where you can see that ductus arteriosus, or in which week we can see the development of ductus arteriosus? Between 6th and 8th week. Okay, can you say it more precise, like particularly in which week? 6th, okay, fine. Any other answers? First tell me where exactly you can see the ductus arteriosus. With the? Between the 3rd and 4th, sure? Between the third and 4th aortic arch, there is a presence of ductus arteriosus. Is it right? Okay, first you all find out where the ductus arteriosus is present and on which week the development of ductus arteriosus will take place, and what is the importance of presence of ductus arteriosus in the developing embryo. Okay, this is your assignment question. Once you know the answer for this question, I'll explain this point. Okay, right now remember, due to the disappearance of some parts of the pharyngeal arch arteries, we can see the abnormalities. Occasionally this process is disturbed, in that some parts that are normally disappear may persist. I can say the 1st, 2nd and 5th will disappear, no, that might present sometimes, and the parts like 3rd, 4th and 6th will present, no, that might disappear. Okay, due to that condition we have abnormalities like double aortic arch, right aortic arch and patent ductus arteriosus. Okay, Next we have the development of venous system. So what are all the important veins we see in our body, or the venous system we see in our body? And what is the source of development? Gross anatomy of heart is finished, right? Only right atrium is finished. Okay. So the gross part is still in thoracic region. Yes. Okay, any idea about the venous system? How the veins of our body is developed and what is the source? Okay, in this class we are only discussing about the development of inferior vena cava and superior vena cava. Okay. Your inferior vena cava is the largest vein of the body that develops from 6 different components. From caudal to cranial, the 6 different components are right posterior cardinal vein, caudal part of right supracardinal vein and right supracardinal subcardinal anastomosis. Then we have right subcardinal vein that is present between the supracardinal and subcardinal anastomosis, and also the anastomotic channel containing the right subcardinal vein. And the another one is the channel that connects your right subcardinal vein to the right hepatocardic channel, and the right hepatocardic channel forms the terminal segment. So this figure shows the development of your inferior vena cava. So at which week the venous system will start developing? Fourth week, sure. And if it starts from fourth week, until which week it will expand or extend? What is sinus venosus? What is sinus venosus? What is sinus venosus? Your sinus venosus is the venous end of the developing heart tube. So what is sinus venosus? It is the venous end of your developing embryo, and it has 3 sets of veins that drain into it. What are the 3 sets of veins that drain into your sinus venosus? Umbilical vein, vitelline vein, and common cardinal vein. So this is your umbilical vein, and this is your vitelline vein, and this part is your common cardinal vein. I can say this is the left horn and this is the right horn. Sinus venosus is the venous end of the developing embryo. It has 3 sets of vein draining into them. Those are vitelline vein, umbilical vein, and common cardinal vein. How the common cardinal vein is formed? Your common cardinal vein is formed from the fusion of anterior cardinal vein and posterior cardinal vein. Okay, so this is your anterior cardinal vein, and this is the posterior cardinal vein. Fusion of this cardinal veins forms your common cardinal vein. Okay, same takes place on the left also. Okay, so your common cardinal vein is formed by the fusion of anterior cardinal vein and posterior cardinal vein. But your posterior cardinal vein is basically formed from the development of the posterior cardinal vein is formed by or formed along with the development of your mesonephrons. Mesonephron. So once your mesonephron starts disappearing or degenerating, along with your mesonephrons, your posterior cardinal vein will also disappear on both the sides. Okay, but the complete part of last But the complete posterior cardinal vein will not disappear, some part will remain, and the remaining part is called remnant. Okay, and the remnant of your posterior cardinal vein gives two important structures. What are those? This is the cranial end and this is the caudal end. Okay, this is cranial end and this is the caudal end. Now your posterior cardinal vein is degenerating along with your mesonephrons. Only the remnants of posterior cardinal vein is remained, and it gives two important structure or two sets of veins. What are those? One is root of azygous vein, and the another one is you guys have textbook, right? At least see that and answer. What is this set called? It's given in your textbook, you can see. The another set of vein is common iliac vein. Okay, so the remnant of your posterior cardinal vein is giving two sets of veins, that is root of azygous vein and the another one is common iliac vein. Your common iliac vein is getting anastomosed in the same region itself. So this is also called anastomosis of the iliac veins. Okay, is it clear for everyone? Any doubts? Any doubts in this? We have a sinus venosus, which is the venous end of the developing embryo. It has three sets of vein draining into it, that is umbilical vein, vitelline vein and the common cardinal vein. Your common cardinal vein, this is the common cardinal vein of right side and this is the common cardinal vein of left side. Your common cardinal vein is formed by the fusion of anterior cardinal and posterior cardinal vein. Now we are discussing only about the posterior cardinal vein. Your posterior cardinal vein is formed along with the development of your mesonephrons. Once the mesonephron starts, what is the reason behind the disappearance or mesonephrons? Okay, once the mesonephrons will start disappearing, along with the mesonephrons, your posterior cardinal vein will also disappear, but its remnants will be there. That remnant will give rise to two important sets of vein. One is root of azygous vein and the another one is iliac vein. Your iliac vein is also forming the anastomose here only. So this particular part is also called the anastomosis of iliac vein. Is it clear for everyone until here? Now I mentioned the disappearance of your posterior cardinal vein is taking place. So imagine now there is no posterior cardinal vein. Once your posterior cardinal vein disappears, the other two sets of vein will start appearing parallel to your posterior cardinal vein and it do the same job as your posterior cardinal vein, and those two sets of cardinal veins are called subcardinal vein and supracardinal vein. Remember the name, subcardinal and supracardinal. The first set to appear is subcardinal vein. So this is your subcardinal vein. Now this is your subcardinal vein. your subcardinal vein is on. Whichever the veins are forming in this will get anastomosed in the same structure. Remember this point. Whichever the veins are forming, they'll get anastomosed in this same structure. So your subcardinal vein is formed. Now it has to get anastomosed within this structure only. Now it is taking place in the middle here. So this part is called anastomose of the subcardinal vein or subcardinal vein anastomosis. Okay, is it clear for everyone? Okay. So in the second part, we can see the supracardinal vein. Once the subcardinal vein is formed and forms the anastomosis, now the supracardinal vein is going to form. Okay. Again, your this is this is supracardinal vein now. Supracardinal vein. Again, your supracardinal vein should also get anastomosed within this structure itself. So now it is getting anastomosed but over the subcardinal anastomosis. Okay. These events are happening in this one structure only. If I draw here, again it will become very confusing, so I am drawing here the second one. Here I have shown the subcardinal part, here I am showing the supracardinal part. Okay, any doubts? At least you guys are getting what I am trying to tell you. So from where we have started? From the sinus venosus, followed by common cardinal vein and umbilical and vitelline vein. Those are draining into your sinus venosus. And how the common cardinal vein is formed? By the fusion of or by combining of your posterior and anterior. And what about the posterior cardinal vein? What happens to your posterior cardinal vein? It just disappears or degenerates. What is the reason behind it? Because your posterior cardinal vein is formed along with the development of mesonephrons. Once the mesonephrons start disappearing or degenerating, your posterior cardinal vein will also disappear. And its remnants give two important structures. What are those? Root of azygous vein and common iliac vein or anastomose of the iliac veins. You can say that also. Once your posterior cardinal vein disappears, what is going to happen? Two other sets of veins will start appearing parallel to your posterior cardinal vein, and they do the same job as the posterior cardinal vein. What are those two sets? Subcardinal, supracardinal. The first one to appear is subcardinal, and the subcardinal get anastomosed in the middle of the structure, and it is called anastomosis of the subcardinal vein. On the other hand, the second one to appear is supracardinal vein. It will also get anastomosed in the middle of the structure, and that is called, no, I said this is happening along with your subcardinal. So what it is called? It is called sub-supra anastomosis of the cardinal vein, or you can say sub-supra cardinal anastomosis. Okay, is it clear for everyone? This is called sub-supra cardinal anastomosis. But the continuity of your supracardinal vein will get disturbed What is the reason? In this region, we can see the development of your kidney. Okay, development of kidney is taking place at this region. So the presence of kidney in this particular region will disturb the continuity of your supracardinal vein. So it divides your supracardinal vein into two parts. This is cranial part or upper part to the kidney, and this is caudal part or lower part to the kidney. Okay. So this cranial part again give rise to two important, or remnants of this cranial part will give rise to two important structure. One I have already mentioned, that is azygous vein, and the another one is hemiazygous, azygous and hemiazygous vein. Now the remaining part is caudal part, or the part that is present beneath your kidney. There is a presence of kidney here, remember. Development, when the venous system is developing, at the same time the development of kidney is also taking place inside your embryo. So here your kidney is growing, it disturbs the continuity of your supracranial veins. So below or above the part is called as cranial part, and below the part is called caudal part. So the above part give rise to azygous and hemiazygous vein. We'll see what is going to happen in the lower part. Basically your lower part will give rise to inferior vena cava. Is it clear until here? Any doubts? Can you see the structure? This is exactly the same what I have drawn, but that is the textbook picture, so I have added that only. This is more like a learning picture. If you learn like that, like this, it will become more easy. You can compare the structures now. Take 2 minutes and compare the structure. Until the C picture we have discussed. So we have already seen what is happening in the cranial part. Now the caudal part, whatever remain, that means below the kidney, is converting into this structure. Okay, this is your inferior vena cava. In the inferior vena cava, we have 4 important segments, that is hepatic segment, pre-renal segment, renal segment and post-renal segment. We'll see which part from this structure forms this structure. Your hepatic segment is formed by right vitelline vein. This structure will give rise to the hepatic segment of your inferior vena cava. Okay, and the pre-renal is formed by right subcardinal vein. Okay, and the renal segment is formed by the supra anastomosis, and the post-renal is formed by right supracardinal vein. So in the caudal part, we can see the development of inferior vena cava, and your inferior vena cava have 4 important segments. The first one is hepatic segment, which is formed from the right vitelline vein plus the hepatic sinusoids of the liver. Okay, you can add that point also. And pre-renal segment is formed by the right subcardinal vein, and the renal segment is formed by the supra anastomosis part, and the post-renal segment is formed by the right supracardinal vein. Did you notice anything in this? Basically this is also right. Why only the right structures are giving rise to your final IVC? What is the reason? What is happening with these left structures then? Whichever we have discussed. So she is telling the left part will give rise to superior vena cava. That's what you said, right? Is that right? No? Then what is the answer? Why only the right part or right structures are giving rise to your inferior vena cava, and what is going to happen with your left part or left structures? Do you know the anatomy of heart? The gross anatomy or general anatomy of heart? Everyone? Where we can see the inferior vena cava? On the right side. What is the reason? It has to go to the right. Say it again. Okay. Okay. She's telling it has to go to the right atrium, so it is basically present on the right side. Is it right? That's why it is on the right side. Okay, both are also right answers. So basically we see the presence of superior in an adult or in a grown-up embryo, we see the presence of superior vena cava on the right side because it is opening into your right atrium. So all the structures of the superior vena cava is basically formed by the right structures in that figure what we have seen before, and most of the left part or the left structure is going to degenerate. They are not going to contribute in the formation of either superior vena cava or inferior vena cava. Is it clear? This is how exactly your inferior vena cava is formed. Any doubt in this? At least you guys understood? Sure? Can I ask some questions? Okay. These four diagrams what I have added or the pictures is same what I have explained there. Okay. You can go like this. In your exams also you can write these answer, no problem. Once you go through this also which is given in your textbook, if you have any doubts you can come and discuss with me. Okay. So all these four segments are raised from this part. Along with that, these four segments will give rise to few veins also. So your hepatic segment give rise to hepatic vein, and pre-renal segment give rise to the root of the left renal vein, right and left suprarenal vein and the gonadal vein, and the renal segment give rise to right and left renal vein. Your post-renal segment does not give rise to any of the veins. Okay. Okay. There is two important or the anomaly. Say it once again. Yes. Why not? The same structures are appearing on both right and left side. The first picture what I have written, no, in that you can see in the both the side I have mentioned right vitelline and left vitelline vein, right umbilical and left umbilical also. But during the formation of the IVC, only the right side structures are involved. Most of the left part will disappear or degenerates. Okay. Okay. The absence of hepatic segment, in few cases, the very first segment what I have written, listen only for 5 more minutes, okay, just listen. Absence of hepatic segment, girls, hepatic veins from the liver starts draining directly into the atrium if there is no presence of hepatic segment, and also the remaining part, that means the pre-renal, renal and post-renal part will join the IVC, and the part of IVC will join directly into your azygous and hemiazygous vein, because this is the lower part. In the upper part I already mentioned we have azygous and hemiazygous sets of vein. And there is one more condition called double IVC. This is your assignment question. It is very easy. Find out what exactly is double IVC or double inferior vena cava, how it is formed, or on which condition we can see the double inferior vena cava. It's your assignment. Last time also I gave you assignment question. Did anybody came up with answer? At least do you guys remember what was the assignment question in last session? Okay, listen. Next we have the development of superior vena cava. I hope the inferior vena cava development is clear for everyone. Any doubts? No? Okay, we are moving into the superior vena cava. What are the two parts of superior vena cava? Two parts we can see. Superior vena cava anatomy is also not finished. No? Okay. In the superior vena cava, we have two important structures, that is extrapericardial and intrapericardial part. Now, how this superior vena cava is formed? It will take only 2 minutes, okay? So, in the development of the superior vena cava also, none of the left structure is involved. Only the right structure is involved, okay? This is your sinus venosus. On the sinus venosus, here we have right common cardinal vein, and this is your right anterior cardinal vein. The extrapericardial will be formed by your right anterior cardinal vein, and the intrapericardial will be formed by your right common. This gives intra and this gives extra. So, the development of your superior vena cava is formed only by the two structure, whereas your inferior vena cava is formed by total 6 components. Okay, here the two structures or two components are right common cardinal vein and the right anterior cardinal vein. Your right anterior cardinal vein is giving rise to extra pericardial part, and the common cardinal or right common cardinal is giving rise to your intrapericardial part. So, as the right common cardinal vein opens into the right horn of sinus venosus, the superior vena cava at first opens into the right horn of the sinus venosus, and when the right horn of sinus venosus is absorbed into the right atrium, the superior vena cava finally opens into your right atrium. It's nothing but this right common cardinal vein opens first into your right horn. This is the right horn. From the right horn, it enters into your venous sinuses or sinus venosus, and in the sinus venosus it gets absorbed. After the absorption, your superior vena cava finally opens into your right atrium. That's all about the development of superior and inferior vena cava.